Namaste, this is Dr. Manasi Harale, and today we are going to speak about ambulatory blood pressure monitoring or ABPM. What is ABPM? It is actually that the blood pressure cuff is attached to your arm for 24 hours. Multiple readings are taken in this time. And when we take these readings, we get a daytime average, a nighttime average, and 24-hour average. So we are very sure that the person has hypertension or not. The BP readings are taken every 15 minutes during daytime and every 30 minutes during nighttime. And that is why we have a majority of readings which will be true to our BP. Why do we need to know this? We need to know this because there is a concept which is called as white coat hypertension, in which the patient walks into the doctor's office and only that time there is a high BP. And two, to rule out marked hypertension, when the doctor suspects this patient has hypertension, he shows ECG changes also of hypertension, but the recording is not. The recorded BP is not hypertensive. That time we do ambulatory blood pressure monitorings. What are the advantages of this technique? Why should we do it when we have only one reading which is going to give us BP? Because while diagnosing hypertension, it is something that we are labeling a patient. So we should be very sure whether the patient has hypertension for that reason. Then, secondly, to rule out white coat and masked hypertension, as I told you, the nighttime readings will be available. We have something which is called as the nocturnal dip. So anybody's, the normal patient's BP should drop down in the night. If the patient is not dropping down his BP, there is no nocturnal dip of BP, then we can place his antihypertensive medication at night. And the disadvantages, yes, it has to be put for 24 hours. Not that it can be seen, it is a very small machine, and if you wear full sleeved clothes, it is covered. But yes, it has to be worn for 24 hours. Can be uncomfortable, cannot be uncomfortable, but this gives a reading to the doctor, which will help to adjust doses, start with a new antihypertensive agent, and convince the patient that he has hypertension. Further, we can prevent the complications of hypertension like heart attack, like stroke, like kidney failures. And that is why we should be using this more and more. Ask your doctor if he can get a ABPM done, even if you are a diagnosed hypertensive patient. Thank you.